So what was the main message of your presentation today?
So my main message was to address some of the issues related to the method that scientists use to answer the question whether moderate drinking is associated with health benefit. So because it's not a rigorous design to answer the question, namely this is so-called observational study. In other words, people are not assigned to beer or wine or spirit versus none of those like you would do in the drug development that FDA would approve. This is a lower standard, and the design is subject to biases. So one approach is that studies have shown that alcohol may be good, some say alcohol may not be good, and then the end consumer is kind of confused. So the question becomes, what's real? And my job is to look at the methodology and say, okay, the new technique to minimize some of those biases. And one called Mendelian randomization is using genetic makeup to try to minimize some biases that could influence the inference, meaning the wrong conclusion. So that's the main message of my talk, that if you use the appropriate technique, such as Mendelian randomization, you can improve the quality of your finding in terms of validity. So that's the take-home message. But with the caveat that it's only applicable if certain assumptions are met. These are technical words. I don't want to go into detail of the technicality, but you need to have a large sample size. So two things: condition for the Mendelian randomization have to be met, and then you need to have a large sample size. And based on that, there's still evidence that moderate alcohol consumption has some health benefit.
What is your overall message of the place for beer in an adult's diet?
So beer, wine, spirits, most studies have not shown a huge difference. So a lot of health benefit of alcoholic beverage, whether it's in beer, whether it's in wine, whether it's in spirit, comes from ethanol. So when consumed in moderation, i.e. 1 drink per day for women or 2 drinks per day for an adult man, we're not talking children, we're talking adults that are at risk of developing chronic conditions like heart disease. If they consume in moderate amount, and they could reap some of the benefit. It's important to notice that if you consume that same amount, like binge drinking, or you pour down 2 glasses of wine within an hour, or 2 bottles of beer within a few minutes, you're not going to get those benefits. The pattern matters. So it's not just the quantity, but how you're drinking it. And then you alternate, obviously, with water, or at least you drink a large glass of water to wash the ethanol in your mouth to prevent oral cancer.
And why do not all research findings support a health benefit of moderate drinking?
That's a good question, and at the heart of my topic, because the fact that there's some mixed messages. Several studies, some are consistent with others, and you have obviously some that are not. The heterogeneity, meaning the lack of uniformity across results, could arise from several factors, including the methodology, the population that you study, the rigors in designing and conducting the study itself. So those are some of the factors that could influence. So what's the reference group? Are you comparing the lifetime abstainer? Are you using the lifetime abstainer as a reference group, or are you using as non-drinkers, which might include people that stopped drinking because of some diseases? So these are several factors that could influence the fact that all the studies are not saying the same thing. So the bottom line is not all the studies are saying the same thing, but the lack of uniformity could be partially explained by the non-uniform methodology, the population study, the pattern, like we mentioned. Are they binging? Are they underreporting? How did the author took care of that? The fact that they may not tell you the truth because you're relying on self-reported information. So those are some of the elements that are making the finding diverse. Some are saying it's good, some are saying it's not good. But when you account for all of those noises and have a rigorous design and rigorous conducted study, most of the studies that have done so show that light to moderate would have some cardiovascular benefit, in particular heart attack, peripheral arterial disease, not hemorrhagic stroke. Ischemic stroke is one of them.
And is there still a net benefit of moderate beer consumption?
Yes, the answer is yes, so far, based on the current evidence. Obviously, I'm not going to give you a blanket statement that forever it's going to be true, but based on what we know today, based on the evidence that's out there, there's a health benefit of moderate beer consumption, in particular as it pertains to heart disease, especially heart attack, heart failure is another one, the type of stroke that is not associated with bleeding in your brain. If it's a non-bleeding stroke, then there's some benefit with beer and other alcoholic beverage when consumed in moderation.
And to finalize, do you have any conclusion that you would like to share with us? Any final message?
So my final message is like any good stuff, moderation is key. So the fact that beer or wine or spirit may confer some health benefit doesn't mean that we're giving you free license to go out and drink uncontrolled amount, but everything in moderation. So if there's a family history of abuse, obviously we're not going to recommend for those people to start consuming alcohol. If the religious ground, pregnancy, definitely a no-no. And for women with higher risk of breast cancer, again, it will be nothing to advise. But the take-home message is that for individual patient, you got to discuss with your primary care physician because they are the one best suited to assess your overall risk and say, okay, either light to moderate drinking may not be good for you or may be good for you. But in general sense, light to moderate, i.e. up to 1 drink per day for women, up to 2 drinks per day for men, would be associated with health benefit.